Hi, my name is Rachel Pangilinan and I'm a nurse practitioner and injection specialist at Skin by Lovely. Today we're using a neuromodulator to treat the masseters. In Allie's case, we're using Botox to treat her masseters for teeth grinding and TMJ. Botox can also be used to slim the jawline on the lateral aspect. So before cleaning, I'm going to feel her masseters and I'll have her clench. And yes, I can feel a bulge pop out when she clenches her jaw, and it's low, close to the jaw. We want to make sure to inject low. Prior to injecting, we'll ice the area to help numb and make this experience more comfortable.